Metformin. It's the most prescribed diabetes medication on the planet. Over 150 million people take it. In the US alone, it's dispensed more than 90 million times per year, and almost nobody knows where it came from. Visual. Corte abrupto para campo aberto com dentes de leão ao vento. Luz dourada. Silêncio por 2 segundos. It came from a plant. A specific plant that European physicians were using to treat diabetes symptoms as far back as the 1700s. A plant that was studied in the 1920s, shown to lower blood glucose in animals, and eventually used to synthesize the compound that became metformin. That plant is called Galega officinalis, goat's rue, French lilac. And its closest botanical relative, with overlapping active compounds and documented blood sugar effects, is something you have almost certainly been pulling out of your lawn and throwing in the trash for your entire adult life. In the next 14 minutes, I'm going to show you what that plant is, what the peer-reviewed science actually says about it, and exactly how to prepare and use it. Not because it replaces your medication. It doesn't, and I'll be clear about that. Because you deserve to know what's growing in your yard, and what it actually does. Let me give you the history that nobody talks about. In the 1700s, a plant called Galega officinalis, known as goat's rue or French lilac, was being used across Europe as a traditional treatment for the symptoms we now associate with diabetes. Excessive thirst, frequent urination, weakness. Physicians documented its use. It was in the botanical pharmacopoeias of the time. In 1918, scientists isolated guanidine from the plant and demonstrated that it lowered blood glucose in animal studies. This was published in the Journal of Biological Chemistry. In the 1920s, several guanidine derivatives were developed as pharmaceutical treatments for diabetes. Some worked, some caused toxicity. The research continued. By the mid-1950s, a French physician named Jean Stern was studying a compound called dimethylbiguanide, developed directly from studying the active components of Galega officinalis. He named it glucophage. The world came to know it as metformin. In 1959, metformin was introduced clinically. By 2011, the World Health Organization added it to its list of essential medicines. Today, it's the backbone of type 2 diabetes treatment globally. Visual, chemical structure of guanidine next to Galega officinalis illustration, side by side. This is not alternative medicine history. This is published in a 2024 review in Diabetes, Obesity and Metabolism, one of the most respected endocrinology journals in the world. The paper states, and I'm quoting directly from the abstract, metformin can claim its origins in the use of Galega officinalis as a plant treatment for symptoms ascribed to diabetes. Peer-reviewed, published in 2024, freely available on PubMed. Now, here's the question nobody asks. If the world's most successful diabetes drug came from a plant, what happened to the plant? The plant I'm about to show you is not Galega officinalis. That's harder to find and not native to most of North America. The plant I'm showing you is Taraxacum officinale, the common dandelion, same botanical family. Overlapping active compounds, documented in peer-reviewed research for its anti-hyperglycemic properties, and growing for free through the crack in your driveway right now. Here's what the science shows. Dandelion contains 4 primary bioactive compounds relevant to blood sugar regulation. First, chicoric acid and chlorogenic acid found in the flowers, leaves, and roots. A 2018 study published on PubMed showed these compounds may improve insulin secretion from the pancreas and enhance glucose absorption in muscle tissue. The mechanism involves activating insulin receptor pathways, the same pathways metformin targets, through a different but complementary route. Second, taraxasterol, a pentacyclic triterpene found primarily in the root, documented in research published in PMC for its anti-inflammatory and metabolic regulatory effects, including effects on glucose metabolism in animal models. Third, inulin, a prebiotic fiber concentrated in the dandelion root. A 2019 systematic review and meta-analysis of 33 randomized controlled trials, published in the Journal of Translational Medicine, found that inulin supplementation significantly improved glycemic control in people with prediabetes and type 2 diabetes. 33 randomized controlled trials. Meta-analysis, significant improvement in glycemic control. That's not folk medicine. That's clinical evidence at the highest standard of research hierarchy. The visual journal covers and abstract screenshots, PMC, Frontiers in Nutrition, MDPI, and a 2024 study published in Plants, MDPI's peer-reviewed botanical journal, specifically examined dandelion and burdock root extracts for anti-diabetic properties, confirming the presence of inulin and phenolic compounds with demonstrated alpha amylase inhibitory activity. Alpha amylase inhibition means slowing carbohydrate digestion, which directly reduces the glucose spike after a meal. The same mechanism targeted by certain pharmaceutical interventions. In a weed you pull from your lawn. Important, stop here. I need to be precise about something. The research on dandelion's blood sugar effects is primarily in animal models and in vitro studies. The human clinical trials are limited. I'm not telling you that dandelion replaces metformin. It does not. If you are on diabetes medication, do not stop taking it based on a YouTube video. Talk to your doctor. What I am telling you is that the bioactive compounds in dandelion have documented mechanisms that affect glucose metabolism, that the research is published in legitimate peer-reviewed journals, and that this plant, which you have been poisoning and removing from your property, deserves more than to be treated as a weed. There's a difference between this cures diabetes and this has documented effects on blood sugar that most people don't know about. I'm talking about the second one, with sources. Let's continue. Before preparation, identification. Because dandelion has lookalikes and you need to know exactly what you're working with. Dandelion, Taraxacum officinale, has 3 identifying characteristics that make it nearly unmistakable. First, the leaves. Deeply lobed, almost like a serrated edge all the way down the leaf. The lobes point backward, toward the base. This is the detail that matters. They form a basal rosette, flat against the ground. And when you break a leaf or stem, a white milky sap appears immediately. This is distinctive. Most lookalikes don't have it. Second, the flower. 1 flower per hollow stem. Bright yellow, made up of dozens of ray florets. No disc florets in the center. Perfectly circular from above. Opens in morning light, closes in afternoon. Third, the seed head. The white globe of seeds you blew as a child. Each seed attached to a parachute of fine fibers. When you see this on a plant with lobed, backward-pointing leaves and hollow stems with milky sap, that is dandelion. Visual. Comparison. Dandelion versus cat's ear versus hawk's beard. Key differences labeled. The most common confusion is with cat's ear, Hypocharis radicata. Cat's ear leaves are less deeply lobed, have a different texture, slightly hairy, and the stem branches into multiple flowers. Dandelion stems never branch. 1 stem, 1 flower. That's the fastest distinguishing feature. Both are edible and non-toxic. But the research is specifically on Taraxacum officinale, so accuracy matters here. Quick pause before the preparation methods. Everything I'm covering in this video, dandelion plus 11 other plants with documented metabolic, anti-inflammatory, and wound care properties, is in the Backyard Self-Sufficiency Field Guide. Each plant has the identification photos, the preparation protocols, the dosage ranges from the research, and the safety contraindications. It's designed to be a reference, something you print and keep in your kitchen, not a course you sit through. Link is in the description below this video. Now, here's exactly how to prepare dandelion for blood sugar support. 3 preparation methods, ordered from simplest to most concentrated. Method 1, dandelion root tea. Daily support. This is the foundation. The root contains the highest concentration of inulin, taraxasterol, and phenolic acids. It's where most of the glycemic research is focused. Harvest. Dig the roots in early spring before flowering, or in fall after the plant dies back. These are the 2 windows when root compounds are most concentrated. Clean roots thoroughly, scrub the soil off, and pat dry. Dry preparation. Slice roots thinly and dry in a low oven, 150 degrees Celsius, for 2 to 3 hours, or on a rack for 1 to 2 weeks. Once dried, lightly roast them in a dry pan until they turn dark brown and smell like coffee. This is the classic dandelion coffee preparation. Brew 1 tablespoon of roasted ground root per cup of boiling water. Steep 12 minutes covered, strain, and drink. The flavor is earthy, slightly bitter, coffee adjacent. Most people find it genuinely pleasant. Fresh preparation. If you don't want to dry and roast, use fresh root. Chop finely, simmer, not just steep, in water for 20 minutes. Strain. Slightly more bitter, but all compounds intact. Dosage. The research suggests 1 to 2 cups daily, with or after meals. The alpha amylase inhibiting effect is most relevant when taken with or immediately after carbohydrate-heavy meals. This is when it slows the glucose spike. Method 2, dandelion leaf preparation. Nutritional plus metabolic support. The leaves are a different tool than the root. They're rich in chicoric acid, chlorogenic acid, and chlorophyll. They're also one of the most nutrient-dense plants you can eat. Higher in calcium than milk, higher in beta-carotene than carrots, and containing significant vitamin K, C, and iron. Harvest young leaves in spring, before the plant flowers, when bitterness is lowest and compound concentration is highest. After flowering, leaves become significantly more bitter. Preparation options. Raw in salad with lemon juice and olive oil. The acid cuts bitterness effectively. Sautéed briefly in olive oil with garlic. Heat reduces bitterness. Blended into smoothies with fruit. Fruit masks the bitter entirely. Or as a tea, 2 tablespoons fresh leaves or 1 tablespoon dried, steeped in hot water for 10 minutes. Visual. Fresh dandelion leaves in salad, then sautéed in pan with garlic. This is the most sustainable daily habit. Growing a patch of dandelion, or simply allowing what's already there to grow, gives you a continuous supply of one of the most nutritionally complete leafy greens available for free in your yard. A tincture extracts and concentrates the active compounds into a liquid that lasts for years without refrigeration and requires no daily preparation time. Make it. Fill a clean glass jar 2/3 full with chopped fresh dandelion root, or half full with dried. Cover completely with high-proof vodka, 80 proof minimum. Seal, store in a dark cabinet for 6 weeks, shaking every 2 to 3 days. Strain through cheesecloth, store in dark glass dropper bottles. The tincture will be deep amber to brown. Shake before use. Dosage: half a teaspoon in water, 1 to 3 times daily, preferably with meals. This delivers a concentrated dose of the active compounds without requiring daily root preparation. Shelf life: up to 5 years stored correctly. One batch provides months of daily use. Visual: amber tincture in dropper bottle, dose being measured into water glass. Cost comparison for perspective: Metformin, without insurance in the US, runs approximately $4 to $15 per month for generic. Dandelion root tincture made from your yard costs the price of a bottle of vodka once, and refills every time the dandelion grows back, which it will, because that's what dandelion does. Now, the title of this video promised something. Big Pharma buried this for 40 years. I want to be precise about what that means, because I'm not interested in conspiracy theories. I'm interested in what's documented. Here's what's documented. By the 1930s and 1940s, several plant-derived guanidine compounds had been tested as diabetes treatments. Some worked, some had toxicity issues. And then, insulin became widely available. The pharmaceutical landscape shifted toward injectable insulin, and the interest in plant-derived oral compounds largely stopped for decades. When metformin was finally brought to market, first in Europe in 1958, then the UK in 1958, France in 1979, and eventually approved in the US in 1994, the original plant that inspired it had been sitting in fields and lawns, largely ignored by Western medicine for 40 years. Not hidden, not conspiratorially suppressed, simply abandoned in the rush toward pharmaceutical development and then forgotten. The dandelion, botanically related, sharing overlapping active compound profiles, was being mowed, poisoned with glyphosate, and treated as an enemy by American homeowners during those same decades. 40 years of people spending money on herbicides to kill a plant with documented blood sugar effects. That's the buried part. Not malevolent, just a catastrophic loss of practical knowledge, replaced by chemical lawn care and a medical system that, for understandable reasons, moved towards standardized pharmaceutical interventions. Understanding that is not anti-medicine, it's just history. Safety and who should be careful. This matters. Dandelion is considered safe for most people and has been consumed as food for centuries, but 3 specific groups need to be aware. First, anyone on diabetes medication. Dandelion has real effects on blood sugar. If you're already taking metformin, insulin, or other glucose-lowering medication, adding dandelion could theoretically lower your blood sugar further. This is called additive hypoglycemic effect. Talk to your doctor. Do not adjust your medication based on adding dandelion. Monitor your levels if you choose to use it. Second, anyone with ragweed allergies. Dandelion is in the same botanical family as ragweed, Asteraceae. Cross-reactivity is possible. Start with a small amount and watch for any reaction. Third, anyone taking blood thinners or diuretics. Dandelion leaf has natural diuretic properties and contains significant vitamin K, which can affect anticoagulant medications like warfarin. Check with your physician. For everyone else, this is a food that humans have been eating for thousands of years across multiple continents. The risk profile for consumption at normal food quantities is very low. Here's what this looks like as a practice. It's 7 a.m. You wake up. Before breakfast, you brew a cup of dandelion root tea. From roots you dried last fall from your own yard. You drink it while reading, then you have breakfast. The alpha amylase inhibiting compounds in that root are working on the digestion of whatever carbohydrates you eat for the next 30 to 60 minutes, slowing the glucose absorption rate, reducing the post-meal spike. That's not magic. That's documented biochemistry. 6 months from now, you go to your regular checkup. Your doctor reviews your numbers. Maybe they're better, maybe they're the same. Maybe your doctor asks what you've been doing differently, and you say, I started drinking dandelion root tea every morning from my backyard. And they either know exactly what you're talking about, because it's in the literature, or they don't. Either way, you know. And you're spending nothing, and the dandelion keeps growing back. That's self-sufficiency. Not dramatic, not extreme, just knowledge applied consistently from what's already there. Here's exactly what to do right now. Step 1, go outside and look for dandelion. You almost certainly have it. Identify it using the 3 markers I covered. Lobed leaves with backward-pointing lobes, milky sap, 1 flower per hollow stem. Step 2, if it's fall or early spring, harvest some roots. If not, order dried dandelion root from a reputable supplier. Mountain Rose Herbs and Star West Botanicals are both reliable. I have links in the description. Step 3, make 1 cup of dandelion root tea this week. See how it feels. See if you want to make it a habit. And if you want the complete protocol, dandelion plus 11 other plants already growing on or near your property, with full preparation guides, dosage notes, safety information, and identification photos, the Backyard Self-Sufficiency Field Guide is in the description. This week, it's at the introductory price. Link below. The most prescribed diabetes drug in the world came from a plant. That plant's closest relative is in your yard. That's not a conspiracy. That's just history that nobody bothered to tell you. Next video. The backyard plant that does what a $400 a month blood pressure prescription does. Same situation, same story. And it's probably already growing in the corner of your fence line. Subscribe so you don't miss it.